My name is Luisana Lopez, and this is my presentation on Medicare. Medicare was created in 1965. Currently, it covers 67 million Americans today. In this presentation, I'll be talking about major components, responsibilities, and the current structure. Then I will go into the role in relation to the U.S. healthcare delivery and impact on health and wellness. Afterwards, I will be talking about major public health challenges and future direction to address those challenges. And finally, I will be talking about applications to public health and resources needed for changes to occur. Medicare has four major components. Medicare Part A, which is hospital coverage. It includes and helps cover inpatient care in hospitals, skilled nursing facility, hospice care, and home health care. So anything that's related to this and hospital care, Part A covers. The next component is Medicare Part B, which covers medical insurance that helps cover services from doctors and other healthcare providers, which if your primary refers you out to a specialty, that would be covered under that. It also covers home health care, outpatient care, durable medical equipment, which it can be from wheelchairs, walkers, hospital beds, and other equipment. And it also covers many preventative services, which it can be screening, shots or vaccines that are, for example, the flu shot, COVID, pneumococcal, or the hepatitis B for the people that are medium or high risk. So this is what Part B covers in this component of Medicare. In this slide, we have the other two components of Medicare. We have Part C, which is Medicare Advantage. It's alternative insurance that's offered by private insurance companies. And with this Type C, enrollees are able to obtain vision and dental insurance. And then we have Medicare Part D, which is for prescription coverage. So with this one, it helps cover the cost of prescription drugs. So this Part D is the only part of Medicare that will cover medication for the enrollees. Responsibilities of Medicare. As of 2023, Medicare covers 64.5 million Americans enrolled in Part A and B. Medicare is to enhance the health and well-being of disabled and 65 or older individuals. It is big on preventative care. It supports individuals with chronic conditions to help them manage their health more effectively, and individuals are able to obtain services like vaccines, screenings, and many other services to any other specialty. Medicare is administered by the Medicare and Medicaid Services, which is also known as CMS. It's responsible to provide health insurance coverage for eligible individuals age 65 or older. It administers and manages Part A through D. It oversees providers who can bill Medicare. So this will fall into the provider network. And also it reviews and approves medical claims under the claim processing. So Medicare is responsible for the people, the enrollees, and also it manages these other four areas when it comes down to giving quality of care, managing the components, overseeing providers, and also reviewing claims and approving them. Current structure of Medicare. So as of today, Medicare has created a cap for out-of-pocket prescription drugs, that cap being $2,000. So if the cap is reached, enrollees in Medicare Part D don't have to continue to pay a copay or coinsurance as long as that cost has been met. So these prescription medications can cover such as insulin, cancer drugs, and HIV AIDS treatment under this Part D of Medicare. Continuing on the current structure of Medicare, as of now, Medicare has a program in place for the mental health and wellness of the enrollees. It has marriage and family therapy. It provides mental health counselors for the enrollees of Medicare, and it has expanded the intensive outpatient program for marriage and family therapy. On the caregiver resource, if an individual or patient has a caregiver, Medicare has sources to train their caregiver for better care for their loved ones. It offers relief if a family member is taking care of a patient in hospice care, so they are able to get respite. Someone will come in and cover for them so they can take that break they need while taking care of their loved one. And Medicare is able to train them on that. Also, the Postal Service Health Benefit Program. It covers U.S. postal employees, retirees, and family members. And they can go ahead and get that cover instead of the federal employee health benefit plan. The analysis and role of Medicare. So Medicare was proposed by Harry Truman in 1945. However, Congress had not enacted on it until President Lyndon Johnson drew attention to it again in 1965 to Congress. Health insurance was proposed and brought up to Congress in 1916. During the Progressive Era, President Franklin Roosevelt decided to have an old age pension provision instead of the Social Security program. The act of the World War II caused the bill to be shelved, which means it was put in the back burner. And then by 1961, President John F. Kennedy made Medicare a legislative priority and recruited Senator Clinton Anderson, who was a Democrat for New Mexico. Clinton Anderson was pretty much a ill and sick man throughout his whole life. So they figured since Clinton knew about being sick in and out of doctor's office and clinics, that he would be able to input more into this bill. They faced many challenges due to Kennedy's assassination and failed to resolve differences in 1964. Due to the alternative version in the House and Senate, it wasn't until Lyndon Johnson that was able to increase support for Medicare in 1965. Anderson was still hard at work and working closely with the House members to expand the scope of the original bill. Finally, in 1965, it passed, and they proposed it as a three-layer cake, which it gave hospital insurance for the aged, physician's insurance for the elderly, and an expanded federal assistance to supplement state medical payments for the poor. Moving on to the impact and health and wellness of Medicare. Since 1965 and the implementation of Medicare in 1966, the entire elderly population in the nation were eligible for Part A coverage and voluntarily enrolled in Part B, and they saw that this ended segregations in the hospital. Through the first decade of Medicare, the average number of services remained at a relatively constant level. The number of hospitals admissions rise slowly, and there were also indications of good health with the enrollees. Eligibility of Medicare expanded in 1972, which included disabled persons who received cash benefits under the Social Security Disability Program and individuals with end-stage renal disease. By 1984, individuals who were enrolled in Medicare, they could expect to live an additional 16.8 years longer. Over the last 3 decades, women's healthcare services made an impact. It created services that included hormonal therapy for postmenopausal women, which decreased osteoporosis, heart disease, hip, and knee replacement surgeries. There was also an increase or growth in retirement and life care communities, which improved and promoted quality of life. Public health challenges. Public health focuses on individuals' overall health and improving their health issues, including disease prevention, disease screening, and treatment. However, public health are faced with many challenges. One of the first challenges would be obesity and nutrition. Half of the US population is suffering from obesity and is going into a huge mortality rate due to the lack of knowledge of nutrition. Diabetes comes from obesity. Some diabetes come from obesity. And being obese, you can take the following diseases, which is hypertension, stroke, some cancers, sleep apnea, and other weight-related diseases that are on the rise. Another challenge is the health equity. As of 2020, we still have issues with providing the adequate services for the vulnerable communities, which includes the poor, and which they don't have the adequate life-saving care or essentials. The next challenge is sustainability, which Medicare's trust fund is expected to disappear by 2026, and these funds are from the hospital insurance and the supplementary medical insurance. So these are some of the challenges that um, Medicare has been dealing with in the last few decades. How does Medicare address these challenges? For obesity and nutrition, Medicare has implemented coverage as the obesity behavioral therapy. This service is included with the screening for the body mass index and behavioral therapy, which they do an assessment with the dietitian, and they provide them with a counselor to help the individuals lose weight and prevent or develop further diseases. With health equity, Medicare strategies are to solve the issues is to ensure engagement with communities and to incorporate screening and promote broader access to health-related social needs. And then finally, with sustainability, budgets being in place and laws being passed. So as of February of 2024, they proposed a bill, the Medicare and Social Security Fair Act, and it's to prioritize the rising revenue from the taxpayers earning over $400,000, excuse me. And this bill has been proposed. What I've learned through the research of Medicare. It is one of the largest federal programs in the U.S. and it is made up of four components, which all have a different role when it comes down to coverage. Part A is hospital care, Part B, provider care, Part C, medical advantage, which helps out the individuals for vision and dental coverage, Part D, prescription drugs. It has given many seniors debt relief, meaning they don't have to worry about medical bills. It also expanded services which include mental health, guide, which stands for guiding an improved dementia experience, so people or seniors with dementia, and many screenings and referrals for specialty services. It was also interesting to know that it took a few presidents and over 20 years to get this bill going, and it has changed many people's lives throughout the time that Medicare has been out. One of those being a close friend of mine. He became disabled and he couldn't afford to pay out of pocket or even pay for a private insurance. So Medicare was able to help him out and give him relief of paying any hospital bills. So Medicare, once again, it's not only for the seniors, but It has also grown throughout the years, and it has provided many services to the enrollees with preventative care. They go in for screenings and give them services they need to get better. And it has also, if you really think about it, it has also probably given seniors a few more years to live. So I think this is a great program, and I hope it continues throughout many more years. And this is my final slide here for my presentation. Thank you for all the knowledge that you have provided throughout this course. And while doing the research for Medicare, it has given me a lot more information, or I've obtained a lot more information on all the parts of Medicare and how important they are to have. Just a quick backstory. My father got ill, and we found out that he was only enrolled in a few components of the Medicare. I think it was Part A and B, but he was penalized for not having Part D. So it does make sense to have all of these components to be signed up in, and so these seniors that do have Medicare can take advantage of everything that Medicare has to offer. So once again, thank you, and this is the end of my presentation.